My name is Dr. Jeff Blank. I am an aesthetic dentist practicing in Fort Mill, South Carolina. The name of my practice is the Carolina Smile Center. I'm also the Chief Clinical Instructor for New Millennium Education. Today we're going to be actually cementing EMAX restorations to complete the smile on teeth 6 through 10. In this particular case, we have used 3M ESPE's Pro Temp Plus. It's a great provisional material. It's obviously a bisacrylic material that we find the handling properties, the setup, the actual shine, durability. Our patient here has done an excellent job in maintaining our tissues during the provisional phase. And what we're going to do to begin, obviously, is to remove the temporaries. Now that we've got the restorations off, I'm going to clean the preparations with non-fluoridated pumice, and then we're going to begin the try-in procedure. Here are restorations created by the lab that we're working with. Typically, I will try these on dry first. So I want to assess the fit of these restorations, each one of them, make sure they're sealing. Prior to numbing the patient up, we want to see that the laboratory has followed our recommendations for the characterization and color of the restorations. One thing that we like to do is to obviously achieve an optimal working environment. Today we're going to be using 3M's retraction paste. There are several things that we like about the retraction paste. One is this unique, very thin tip. There are a lot of different pastes obviously on the market. The 3M ESPE retraction paste is ideal with this, with basically a hummingbird type tip. And what we can do is we can actually just syringe, lightly place this in the sulcus and then begin extruding the material around the actual preparation. It's unlike some of the products that are on the market. This is easy to rinse away. We use the RelyX try-in paste. It's also compatible with the 3M ESPE RelyX Ultimate Resin Cement, which we'll be using to cement these crowns with. I like the fact that I can easily rinse it away. Once we have the try-in paste in place, we're going to be assessing, obviously, the contacts. We're going to make sure that they're smooth. And of course, what we like to do is obviously have the patient look at the restorations, make sure she approves the color and obviously the alignment, general overall aesthetics of the restorations. Obviously, we've had the patient approve the restorations, so we're going to begin removing them. There's two components. There's the Scotchbond Universal, which is the adhesive that's applied to the tooth, and then obviously the cement itself is a dual cure material. There are co-catalysts that allow the adhesive and the cement to set up. And I will use a paintbrush to apply it to the teeth, just because I can cover the surface faster. And you're going to allow that adhesive to sit on the teeth for 20 seconds. We typically time that exactly. And then the objective is to take moisture-free and oil-free compressed air, and I'm going to be air thinning, removing any excess or residual material from the teeth themselves. And then she'll begin drying the actual adhesive in each restoration. And as you can see, Ashley will use the pointer when I begin loading each restoration. The objective in loading is I tend to use more than probably I need. One of the objectives I have is when I seat these things, I really want to make sure that I have cement flowing 360 degrees around each preparation. And I'll hold these into place, and we'll just very briefly run a light across. And again, good. And that brief exposure to the curing light, and again, that was a 3M ESPE Elipar S10 curing light. Probably one of the best LED lights I've worked with. And this is going to be, what you're seeing now is what I would consider a top feature of this particular cement, is obviously the ease in which this material is cleaned up. I will pick any cement that may have gotten down in the contacts out. Now we're going to actually definitively cure these restorations with the 3M ESPE Elipar curing light. I will go from the lingual, and this expedites it. We typically advocate 1 minute per tooth. We typically divide that up, and she's curing for 30 seconds from the front, and I'm curing for 30 seconds in the back. And after we have totaled a minute for each tooth, It's time to rinse everything off and have a look. Everything's cleaned off and I feel I've got 100% of the cement that I can see anyway. Then at this point I'm going to ask the assistants to take x-rays. We try to take basically an anterior bite wing. 3M ESPE makes a fantastic finishing and polishing system. It's a two-step system called the 3M Soft Flex Spiral Wheel. But I'll start with obviously the finisher, which is the darker of the two. And if you use this, it's not going to mar the ceramics at all. This is just really getting off any residual cement that we may have. And then if you feel as though you want to carry it one step further, you can use the second step, which is the polisher, just to make sure that you have everything removed and there's no residual cement. With a good laboratory, good preparations, good impressions, obviously if everything's in place, the amount of work that I have to do at delivery is minimized, and as you can see, we've expended almost no effort in cementing these restorations using these 3M ESPE products.